Welcome to the Medical Marijuana and Wellness webinar series. Tonight's topic will be arthritis and medical marijuana. And I want to thank you all for joining us. I know that for those of you that do have arthritis, this is something that's not a picnic. It's something that really is not only just painful, but it also gets in the way of you being able to conduct your life on a normal basis. Tonight, I'll be joined in a few moments by Dr. Terel Newton from the medical director for Trulieve, Florida. And we'll be discussing this particular subject. What I'd like to do is like to cover a few housekeeping issues initially, so that we can have a successful webinar. Let me share the presentation with you, so you can see. There's a couple of things that I think are important about tonight's webinar. First of all, it's one of a number of webinars that we're giving this quarter. As you can see over here, we have not only arthritis, but we have next week we'll be doing sleep, routes of administration, migraines, cannabinoids, and terpenes over the next couple weeks. So please feel free to join us. And this is a webinar. It's really here for informational purposes. It's not meant to be medical advice of any kind. So anytime you need medical advice, please consult your physician for your guidance on this particular subject. Also, I want to point out that tonight's webinar is being live streamed, and it's being live streamed on Facebook. I'll be mentioning to you in just a moment. You'll be getting a copy of this webinar, a copy of an email linking you to this particular webinar in video format, as well as the presentation. You'll be getting that after the webinar, and thank you very much. Dr. Newton, thank you very much for joining us.
Hi, great. Can you hear me okay?
Right now, we can hear you fine. I'm going to take this off of sharing mode for a moment. Thank you very much for joining us. I know for those of you who don't know Dr. Newton, you're the medical director for Trulieve. Tell us a little bit about yourself and what you do, and more importantly, tell us about tonight's subject.
Yes, so I'm a board certified anesthesiologist, and I'm fellowship trained in interventional pain management. So that's where we use a variety of techniques for patients dealing with pain symptoms, one of which could be arthritis, disc herniations, headaches, different types of back pain and joint pain, various conditions. And as the medical director, I oversee the operations of the dispensary and also try to provide education for physicians, for our staff members, our community educators. And I believe in being heavily involved in this industry because this is an amazing tool. There's nothing like it in all of medicine. It gives us a lot of versatility to help patients with a variety of medical conditions.
Great. So what I'm going to do is I'm going to go back to the presentation, go back here. And I do want to point out that a few housekeeping issues. If you look down over here, you'll see like a double bubble that says Q&A. We're going to be here. We're here to answer your questions tonight. One of the main reasons we do this webinar is to be able to answer questions for patients. Please feel free to ask any questions, put it into the Q&A. I know some people like to put it into the chat button, which is more over here, but we'll be closely following the Q&A button, and that's probably the best place to put your particular questions. The reason that we do these webinars is real simple. We really want to help you get your life back. I've conducted a number of webinars over the last couple of years, and the one thing I love to hear from patients is their statement, "I got my life back." I know that especially with arthritis, it's crippling in certain cases and keeps you from doing a lot of the things that you want to do. So I want you to understand that we're here to answer your questions, see if we can provide some relief and help you be able to lead a life closer to normal than you currently are, and hopefully close to back to where you normally were. Now, I do want to point out, you will be getting an email as a follow-up to this particular webinar. That email will have a link to the webinar video. It'll be a link to a YouTube video. You'll get a copy of the slides and flipbook presentation, speaker information, discounts that we'll be talking about during the webinar, and any other pertinent information that's out there. So please stay tuned to that. You don't have to take copious notes. You'll be getting them again with the presentation and with the video. I do want to point out that it is being live streamed, and you'll be able to be getting that in just a moment. So Dr. Terel, let's jump in. Before we began this, we were doing some practice session. You had some learning objectives. Why don't you take us through those?
Yeah. Well, one thing I want to mention before I get into that is this is Mental Health Awareness Month. And, this is very important to address a patient that's dealing with pain issues, because if you're dealing with significant pain issues from arthritis, that can lead to anxiety, it can lead to depression, it can lead to problems with obesity because you're not moving around as much, and other health problems. But with this being Mental Health Awareness Month, I just wanted to relate the topic. It does relate indirectly. So if someone's dealing with severe arthritis, they're suffering, they're in pain, they're not getting help from injections, or they're not a candidate for injections and physical therapy, this offers another means of getting significant relief. So, with the learning objectives, we want to answer these questions. So what is arthritis? So we want to give everyone an understanding of the medical topic that we're talking about. We also want to answer the question, does cannabis help improve arthritis? And if it does, how does it work for arthritis patients? And then we want to later on dive deeper into which cannabis plants can help improve arthritis symptoms and what specific products are available to help improve those symptoms as well.
Great.
So
well, that's a lot of information to go over.
It's a lot of information, but it's good. It's very useful information. And while we're going through the slides in the presentation, we'll be talking about arthritis, but we'll also be talking about other conditions, because there are a lot of positive side effects that can come from the use of cannabis when the right patient gets it for the right condition. And so, some people might have heard of arthritis as Arthur. That's what my grandmother used to say. He's like, I got Arthur coming and bothering me. So she would be talking about the joint pain in her hands and her knees. And when we think of arthro, that means joint, and itis, which means inflammation. Arthritis is inflammation of the joint. But it's not just inflammation of the joint. It could also be degeneration of the joint. So if you ever hear about wear and tear, degenerative arthritis, that's another cause. But when we look at causes of inflammation in the itis, there's a variety of causes from that. It could be from anything from an injury, it could be gout, it could be pseudo gout, it could be the immune system attacking the joints, that's rheumatoid arthritis. It could also be lupus. So there's a variety of different situations where a patient can have inflammation of the joints. And with chronic pain and similar conditions being a qualifying diagnosis in Florida, patients become, they become eligible. And the majority of states that have medical marijuana laws, different types of pain is a qualifying condition.
Great.
So here on that list,
with arthritis itself, you mentioned, it is the symptoms show up in your joints, the redness, the swelling, but also you mentioned the other conditions as well.
Yeah, so patients can have concurrent conditions. They could have problems with the muscles. So, when I hear about fibromyalgia, I always think about, it's like a nerve sensitivity syndrome. So, if we're looking at the tendons or the muscles, and when you press on those muscles, they're very sore, and you can elicit a pain response, that's fibromyalgia. When you look at diseases of the immune system, and they're attacking the joints, but they can attack anything from the blood cells to the heart. Now we're talking about lupus. With injuries, and this is a condition that I see in most of my patients, is you could see not only a traumatic arthritis, you could also see disc herniations, you could also see muscle strain injuries, you could have injuries to nerves, so where you have numbness, tingling, and weakness. With regard to our diet, there's certain dietary factors that put a patient at risk for gout. So if they're eating a lot of meats, eating a lot of food that contains, animal cellular contents, that could increase the risk for gout. And gout is usually felt in the big toes and in the feet. And then there's a very similar condition called pseudo gout. And the way you tell the difference is look at the joint fluid under a microscope and look at the crystals. And even psoriasis can be associated with arthritis. And that's called psoriatic arthritis, where you get changes in the skin and changes in the medium to large size joints that can also cause inflammation.
Sure. So
the two main categories for arthritis are rheumatoid arthritis and osteoarthritis. So when we think of rheumatoid, that's the autoimmune disease where the body is attacking the lining of the joints. And then we have osteoarthritis, which is the more common type, which is more the wear and tear, the degeneration of the joints over time.
Sure. So it's kind of interesting that, you had mentioned that your family, I think everybody's family has had arthritis in it, one way, shape, and form. I know when I had a knee injury and had knee surgery, one of the resulting effects was arthritis, and it's no picnic. It hurt. That's the best way of putting it, and stopped me from doing things. One of the questions that comes up is does cannabis help? I think here's a couple studies. You might want to mention some of the studies that are out there done by some pretty prestigious groups that have basically shown that cannabis and arthritis and can help arthritis.
Yeah, it's, arthritis can be a tough thing to treat. So if a patient undergoes, a course of physical therapy, let's take, for example, knee pain. You may also be prescribed a knee brace. And if the knee brace isn't helping, you've had x-rays, MRIs to confirm the diagnosis, you might undergo a course of injections and different treatments trying to avoid knee replacement or anything more invasive. Then cannabis is something that can be tried. And, these studies look at, okay, how many patients are already trying cannabis? And so as many as 1 in 5 who consult an orthopedic surgeon for chronic musculoskeletal pain is using some type of cannabis product. And so this was published by Harvard Medical School. And if we look at, patients that are trying to try different products, 9 out of 10 say it was effective in managing their pain, and 4 in 10 say it decreased their reliance on other pain medications. So that's fairly significant. And about 6 in 10 say cannabis products was more effective than other drugs. So that's very significant, where you have more than half of the patients that's trying this saying it's more effective than other medications that I'm taking.
And that's a pretty recent study that was done in May 2020.
So, I mean, that's pretty tremendous. Anything as far as, going with pain and in the medical field, if we can get 30% or more, that's a success for the patients. But to see like twice that, that's just tremendous. And we see more of the large arthritis foundations looking at and taking polls of their patients, and we're seeing that it's being tried for arthritis. One of the biggest push for medical cannabis has been cancer patients, epilepsy, and other serious conditions. But now we're starting to see more patients with arthritis, and we're starting to conduct more studies and see how many patients are trying it and who's getting benefit, who's not getting benefit. So
Sure.
The Arthritis Foundation did a survey, and they found 29% of patients reported using CBD, and nearly 80%, or 8 out of 10 patients that were using it, or you have used it currently or used it in the past. And they also reported positive side effects like increased physical function. So they were able to walk for a longer period of time or stand for a longer period of time. They were able to sleep and had more of a sense of well-being. And that's probably due to a few factors. One is having better pain control. And then the other thing is having improved sleep. So if you're sleeping better, your body's going to be in more of a balance. And even losing sleep can cause pain, because now you're dealing with muscle spasms, and you can get into a pain cycle where you can't sleep, you have more muscle spasms and less activity that leads to more spasms.
Sure. So let's talk about what medical cannabis cannot do and what it can do.
So this is just, taking a look at the scope of what we're talking about. So with cannabis, one of the things that cannot do is really, cure the arthritis. It is reducing the inflammation, but it's not necessarily, reversing the degeneration that's there. And when we talk about, the degeneration of the joints, we're looking at something that's difficult to heal. And so it'd be nice to look at, studies that show what can regenerate the tissue. So that's one of the things where a patient may want to think about concurrent therapies, not just taking the cannabis, but also looking at things like stem cell injections of PRP, things that can help actually rebuild the tissue. Cannabis cannot cause a fatal overdose, and that's because there's no receptors in the brainstem suppressing the patient's breathing. So that's very similar to muscle relaxants and of course opiates, especially when mixed with alcohol. So what cannabis can do is can reduce your level of pain. It can reduce the inflammation, and patients can actually see a difference. So for example, if there's a rheumatoid arthritis patient dealing with swelling in the hands, you can actually see a difference where the swelling is reduced over time with taking various types of cannabis medicines. And we're looking to improve the overall physical health. And the way we do that is once the pain is improved, the patient can engage in more activity, decrease the risk for obesity and heart disease. It can also help with, as we were mentioning before in the beginning of the presentation, mental health. So you're having less pain, there's going to be less anxiety, there's going to be less stress.
Right. And I'm going to point out something you pointed out just a moment ago. No one has ever died from using cannabis, both recreationally or medically. I think that there's always a phobia when you're using things like this is, can I get addicted? And more importantly, will it kill me? We've got some strong evidence that you're not going to die from any fatal overdoses. And I think that's important for everybody to understand. Much safer than a lot of the pharma drugs that you find out there. So
yeah, and every month we're seeing more and more research. There's literally been an exponential increase in the amount of research studies that have been done. And this is one of the best resources, PubMed. So anyone can go to this website. You don't need any special login or anything like that, or have to any special credentials. And you can just.
I might point out, this is done by the National Institute of Health, the U.S. government's NIH, and it's a database available not only to doctors but also to the public. And what a lot of researchers do is they put their research into PubMed, which gives doctors like yourself the information you need to be able to treat your patients. It's kind of the information well that everybody's pulling from. So tell us a little bit about what you see out there.
Yeah, so the studies are showing that there's a lot more evidence where we're looking at, does cannabis help with arthritis pain? Does it help with these symptoms? And you see various descriptions where patients are taking medical marijuana as an alternative therapy, and it's being used sometimes with prescription medications, and patients are tapering down on their prescription medications. And there's increased research showing that cannabinoids actually improve the pain in many different ways, and it's not just reducing the inflammation. And there's also some research studies that have shown that CBD is a safe and useful treatment for arthritis-related joint pain.
Mm-hmm. Sure. And there's a group called the Americans for Safe Access. They're one of the advocacy groups for cannabis. They've gone out and taken a look at this subject and basically shown that it actually is very effective for cannabis and much safer than a lot of the pharmaceutical options that you have.
And one of the great things is these studies are not just being done in a petri dish and not just animal studies. These are human studies that are being available now. Sure. And they're showing how patients are having significant relief and even reducing the amount of non-steroidal anti-inflammatories. So for example, ibuprofen and naproxen. And that is one of the main reasons where patients can be admitted to a hospital because of a medication complication. And that's ulcerations in the stomach, which can cause gastrointestinal bleeding. So if we can help patients wean off of those medications, we can help them reduce the risk of having gastrointestinal bleeds and other complications, high blood pressure, problems with the kidneys, and other serious issues.
Sure. I've been doing medical marijuana seminars. We did about 195 of them. Seminars now, we're just top 90. I think it's our 91st webinar since COVID joined us in this world. But before we ended the seminar series, I was in the villages, and I had a chance to meet a lady. Her name, they refer to her as Nana. And Nana was the great grandmother of one of the people who helped us promote the webinar, who worked at in the villages at the newspaper. And she had a severe case of arthritis, to the point where, candidly, when I met her, she did not like to be in public. She could not hold a fork. She could not hold a glass. She couldn't change her remote control. And she just was not only physically what I called crippled, but also mentally, it really put her back. You talked about the mental health part of it. She came to one of the seminars. I know her husband Pop was actually vehemently against cannabis. He said he felt that she was going to end up like the Marlboro man, smoking herself to death. But she actually had a problem. She got a card, and we put her on some medical cannabis, and literally within weeks, she began to see relief from the arthritis, to the point, which was very fascinating, to the point where she got to a point where she was actually being able to not only be able to hold a fork and knife, a glass, remote control. She was able to go out in public. She felt comfortable being seen in public again. She wasn't embarrassed about her particular condition. And I know that over a period of time, after about a year, she went back to knitting. The lady was playing golf. I mean, she's 88 years old out there playing golf and using her hands. And she would come up to me and clearly tell me, I got my life back. This has been something that has really helped me quite a bit. Now, this was a couple of years ago. Nana is still with us. She's still leading an active life. And then I think the thing I want to point out about this was she lived for years with this cloud over her head with respect to arthritis. And you talk about the mental health issues. This was something that was spiraling her, and Pop down. Now, she got on medical cannabis. It helped her quite a bit. Pop also got on it for a number of his reasons. And this is a couple that have really, I think, improved their quality of life. And we don't, for those of us that are senior citizens, we don't have a whole lot of time left. So a little bit of time we have, let's go enjoy it, and let's not let this black cloud hang over us. And I think this is really important. I wanted to point this out because this is someone who suffered and did not go to the well to drink. And when she finally did, realize that she waited way too long to do that. And that's what I'm trying to point out. We want to help you get your life back and hopefully, promote your story as well. So I just thought I'd bring that out as like an anecdotal evidence.
Yeah. And one thing, with rheumatoid arthritis affecting the, smaller joints of the hands and fingers, it's amazing the difference that you can see, like even within 3 days and sometimes within 24 hours of, a patient taking a topical. The good thing about the joints is, when you're dealing with smaller joints, you need a much lower dose so you can get much more absorption. And actually, toward the end, we'll go over one of the products that can help increase absorption. So we talk about, when you take a medicine, how much is actually getting to the site where it's working. So with a variety of topical medications, and you can often combine that with an oral or a vapor, you can get more medicine in the bloodstream, more medicine to the joints. And I really like, adding topicals for rheumatoid arthritis patients because you're getting medicine there more directly and not always having to consume it orally or through a vapor pen or smokable form. And you can just take medicine, wherever you are. There's some restrictions where you can't vape in certain areas and things like that. But the great thing about a topical is you can take that anywhere you go.
Sure. And I also want to point out one of the other benefits, not only the mental and the ability to have her life, she was able to get a full night's sleep for the first time in a long time. This has to do with the entourage effect, which I think we're going to talk about in just a moment, about what cannabis is all about, because we all have a nervous system, right, Dr. Newton?
Well, I hope so. It might be some of us. I don't know if you remember the Homer Simpson cartoons. The brain scan and he didn't have anything in there.
Sure.
But so, our nervous system is so important because it tells us about the surroundings. It tells us, if we're in pain, so that way we can address those issues. And it's basically the body's communication system. And we have a system within our bodies that gives us a steady state. So it's called homeostasis, and that's our endocannabinoid system. And it's made up of our nervous system and also our immune system. And when we talk about endocannabinoids, endo just means in the body, and then cannabinoids is the cannabis that's in our bodies. And so we have a type of cannabis, which is a neurotransmitter. We actually have a couple of them where we try to maintain our steady state. And the cannabis that's in our bodies is called anandamide and 2-acylglycerol. There's no need to memorize it, but just be familiar with, we have signaling agents that our body already makes. And when we add the plant-based cannabis, we're basically just supplementing what's in our bodies. And the cannabis in our body is actually made on demand. So it's not like we can just release it immediately and it just comes out. It takes time to, synthesize and release it. But with the plant-based cannabis, we can immediately get relief because we're taking the plant-based phytocannabinoids to help supplement our endocannabinoid system.
Sure.
And so this is how we maintain health. This is how we reduce inflammation. It's also help us maintain our metabolism and maintain the, how we rest and digest our foods, how we make our hormones, and also how our bones develop. There's even research that has shown that CBD can help reduce the risk of fractures and actually facilitate healing. Okay. And with regard to arthritis, I know we're talking about something a little bit different when we're dealing with fractures, but it's a way to reduce inflammation without hindering bone healing. And so when we look at ibuprofen and naproxen, if a patient is dealing with like a compression fracture, for instance, or a bone fracture, this is a way that we can actually, continue to treat pain without hindering the healing process.
Sure. I mean, I kind of tend to look at this as, our nervous system is like the cell phone system within our body. It helps our body communicate from one point to another. But when there's a problem, the nervous system says to the brain, Houston, we have a problem. The question is, what does Houston do about it? And what we for years did not, we were still trying to figure it out, and finally found out in the late 80s, early 90s, is we had an endocannabinoid system that really helped our body stay in balance. We call it homeostasis. And that's what it does. The nervous system handed to the endocannabinoid system the problem that went out and really tried to attack it through the whole body. And it's very fascinating how this whole process works. And it's been with us for a long time. It's no new news for our body. It's only new news for us that's studying it.
Yeah, well, some patients don't have a cell phone. They have low endocannabinoids, and so they're dealing with the rotary system. And if we supplement the cannabinoids, we bring them up to the cell phone time periods. So,
so
it's very interesting, the research that has shown that patients, that have deficiencies in their own endocannabinoid system, that can lead to things like fibromyalgia, irritable bowel syndromes, that can lead to migraines. And so with self-signaling, one of the things that our nervous system does is it dampens the pain signal. So we have our body's own morphine, our body's own cannabis system that helps us deal with pain, helps us deal with inflammation. But if we're deficient in that, when you supplement that, that can help overcome disease processes.
Sure. Now you were mentioning the endocannabinoids and phytocannabinoids. Again, the endocannabinoids are produced by your body, and the phytocannabinoids are produced by cannabis. And what's interesting is they found out that the phytocannabinoids are structurally almost identical to the endocannabinoids, or to the cannabinoids in our own body.
So it's basically like a lock and key system, right? So you have a lock, you want to, open up the door. So the key that our body makes is very similar to the key that the cannabis makes. And so when we look at THC, it's attaching to our CB1 and CB2 receptors that's in our endocannabinoid system. And so that's one of the ways that it works, where proteins, which are on the surface of the nerve cells, they're called receptors, and they're being activated by the THC that's supplementing the body's cannabis.
Right. What's fascinating is, I know that I showed a little picture here. A lot of people say, why do we show all these flowers? I know that I got a question today from a patient. Every time I talk about cannabis, they show me these funky looking flowers. Why is that? Yeah. Well, I think what they're really trying to show you is, and we kind of blew this up right here, this is what cannabis is all about. These plants right here have these things called trichomes. And that's really what the whole cannabis industry is about, because the cannabis industry is where the abundance, I wouldn't say all of, but the abundance of a lot of the cannabinoids are stored within the plant itself.
Yeah, I want to mention something as well. So, when we look at these structures here, we're not talking about seeds, okay? So, in the seed stage, the plant hasn't grown up and made the glands that produce the cannabinoids. And in a second, we're also talking about terpenes, okay? So when we talk about seeds are very nutritional. They have a lot of protein, magnesium, and a lot of nutrients, very healthy for you, but they're not going to have the CBD and THC. So when we talk about hemp seed oil, okay, hemp seed oil, there's not going to be CBD and THC in there. When we talk about hemp oil, that can have some CBD in there. So that's one of the categories of medical marijuana, is when there's CBD with minimal THC, that's hemp oil. Mm-hmm. When we talk about from the seeds, that's hemp seed oil that you can buy retail. With what we're talking about, you need your card, your medical marijuana card. And then we have something, cannabis that's higher. And for Florida, 0.8% is our cutoff. That and above is going to be your medical marijuana. So for Florida, 0.8% and less is your low THC, high CBD. And then above that is going to be your medical marijuana. So that's where you're going to have more of the THC products, which we'll get into more detail with that later. But I just wanted to explain that, we're talking about separate things when we're talking about the seeds versus the actual plant. Yeah, okay, the seeds are very good nutritionally. And now we're getting into the plant, specifically the trichomes, those beautiful crystals there. That's where the cannabinoids, that's where the terpenes are made.
Yeah, well, the abundance of them that are there, that are out there. Great. Now, when you take a look at cannabis, what makes it so unique is I tend to look at cannabis as almost a medicine cabinet, and medical marijuana is the way of unlocking that. I mean, I don't think there's another plant that we really, maybe doctor, I don't know of another plant that has the medical benefits of cannabis, all the different medical benefits of cannabis. Obviously there are plants with medical benefits, but not one that has this many medical benefits all in one plant.
It's amazing that there's thousands of varieties, which we call chemobars, of the cannabis plant. So some could have high THC, some could have high CBD, some could have high amounts of both. Some can just stop at what we call CBG, which is the grandmother of all the cannabinoids, cannabidiol. Some can have minimal to no THC, but have a lot of terpenes. And terpenes are the compounds that give cannabis the different smells, the different colors. And when we combine different cannabinoids or combine cannabinoids and terpenes, we have something called the entourage effect. And so basically, we're taking low doses of multiple medications to have the patient, get benefit in inflammation for arthritis, to have them get benefit in sleep, get benefit, with anxiety, depression. And so this is how we could have a medicine. And I look at it as even a pharmacy, because we're talking about hundreds of cannabinoids, we're talking about hundreds of terpenes. Now, we don't have to memorize, but we do need to be familiar with the most significant, the most abundant ones when we give our patient recommendations, so we can give them some guidance. So if we're familiar with these right here, THC, THCV, CBD, CBN, CBC, CBL, I'm just giving the initials so you don't have to worry about memorizing the actual names. And even Delta 8 THC, I don't know if that's on there as well. So we can combine those cannabinoids with terpenes, and we'll get into the terpenes in a second, and there we get an entourage effect. So we have two substances that's helping with arthritis, and so we say it's synergistic. So when we add one and the other one, we get an effect that's greater than if you just added them both.
Right.
And for those that want to get deeper into why that works, this is why it works, is because we're talking about inhibiting enzymes, right? And so an enzyme doesn't just attach to one molecule and break that down and then die off. So enzymes attach to one molecule, break it down, then the next one, then the next one, then the next one. So, enzymes undergo thousands of reactions in just a few minutes, if not more. And so if we're affecting that enzyme activity in not only one pathway, but affecting it in another part of that same pathway, then we can get an exponential improvement. So we say 1 + 1 = more than 2. And that's our entourage effect. And this is going deeper into why, and that's because not only THC, but also CBD can interact in the pain pathway in more than one area. So not only is it reducing where there's inflammation, it's also decreasing the pain signal. It's also helping the patient relax. It's also activating protein channels. And so it's also balancing out hormones. And so that's where 1 + 1 = much greater than 2, because you have CBD, which is relatively weak, but it's interacting at many receptors. And you have THC, which is relatively potent, acting mainly at the CB1 and the CB2 receptors for not only helping with the pain, but also helping with the inflammation.
Yeah. And working together, they synergistically, it's almost 1 and 1 is 3. This is kind of really interesting. And that's one of the things that confounds really the Western version of what we call medicine today. They like to test one component, one form of administration, and one symptom, and that's fine. But what's interesting about cannabis is when you mix them together, they see THC and CBD, the different cannabinoids together, it actually produces more benefits that are out there.
Right.
And that's the really the magic of cannabis. That's why it's such a big deal. You'd mentioned THC and CBD interacting with the CB1 and CB2 receptors, but I think CBD also has a side to it that it interacts with a number of other receptors.
Right. And so, one thing I want to mention before I say this here is, in anesthesia, what we often give is something called a balanced anesthetic. So we're giving a number of different medications in lower dose to reduce the side effects. So if you give one medication in a very high dose, you're more likely to drop blood pressure, you're more likely to decrease heart rate. So we try to give more of several different, meaning 3 medications in lower doses rather than one at a very high dose. So that reduces the side effect profile. And that's what happens here as well. So with CBD, with it being relatively weak compared to THC, you're less likely to see a lot of side effects with CBD. But when we add just a touch of THC, we add the terpenes, then we get a much better, smoother effect, less side effects. And with CBD, it's interacting with multiple receptors. So we see here on this diagram, A2A receptors, GPR55 receptors.
Let's look at right here. This is exactly
5-HT,
the receptors and what they do.
Serotonin receptors.
Yeah.
And so this is what I was talking about before about, CBD protecting the bones. So if a patient has a fracture, regulates bone cell function and blood pressure. look at CBDA. So this is, CBDA is the precursor to CBD. And so this is what is actually in the plant before the plant products are heated or prepared. And this is a COX-2, so it's an inhibitor of inflammation. So if you've ever heard of Celebrex, that's a COX inhibitor. So that's going to decrease what we call the cyclooxygenase enzyme to reduce inflammation. So CBD is working in several different areas. And with serotonin, this is how it helps with stress. This is how it helps with anxiety and PTSD. CBC is cannabichromine. So that's interacting with receptors that's associated with heat sensation. So if you feel a burning, shooting pain, this is one of the products that could help if you have cannabichromine in there. CBDV, that's just another version of CBD. And with this, it's going to regulate your body temperature. It's going to regulate hyperexcitability. So if the nerve is firing too much, it's going to slow that down, which you see in seizures. You see that in chronic pain syndromes as well. THCV, one thing I like about this one is this is one of those things that has a positive side effect of reducing appetite. And so a lot of patients may worry, okay, if I take cannabis, am I going to be eating? Am I going to have the munchies all the time? This has been shown to reduce appetite. So this is like a positive side effect. It's not a qualifying condition to take it to help reduce your appetite, but it is a positive side effect. And if the patient's particular chemobar, if the strain that they're taking has this THCV, it's an appetite suppressant, but it also helps with epilepsy. It also helps with pain as well. So they're getting some positive side effects while they're treating their qualifying condition.
Great. Well, since you're talking about cannabis, really a lot of the magic of cannabis also comes from the terpenes. The terpenes that are inside of the cannabis plant itself. And there's, as mentioned in the slide before, there's about 120 terpenes that have been identified. Probably about 40 of them have been really seriously studied, but these are kind of the top 6. These are the ones that are in many of the common strains of cannabis. Tell me a little bit about them.
Well, I mean, have you ever been somewhere and just said, what's that smell? I smell some good weed somewhere around here. That's the terpenes.
So are you trying to tell me that cannabis, these terpenes are very much like essential oils?
Yeah. So, pure CBD and THC don't have a scent to them. And what we're smelling is the constitution and basically the combination of terpenes. So some cannabis is going to smell more sweet. Some is going to smell more kind of like earthy. Some is going to smell more pungent, like sour diesel. Some is going to smell, more like eucalyptus. And this is why there's so many different varieties and so many different what we call chemobars of cannabis, because they have various concentrations of these terpenes. And a couple of the terpenes, these first two, limonene and pinene, are very important for pain. And we see the effects: elevates mood, relieves stress, relieves heartburn is going to be like one of those positive side effects. With alpha pinene, that's very important as an analgesic, anti-anxiety, and also going to reduce inflammation. I think at the previous webinar, we had a patient asking about asthma and how cannabis can help. So this is one of those things where it's a positive side effect. So as a bronchodilator, the strains and the chemobars that have alpha pinene are going to help open up the airways. And if you ever walk through a forest and you notice you can breathe a lot better, not just from the fresh air, but also the alpha pinene in the air, you're giving yourself some aromatherapy.
Sure.
Linalool, this middle one here, is in the lavender plant. It functions actually as a local anesthetic. So, if you ever find a topical that has some linalool, that's a great way to start, because you're getting some topical anesthesia, but also you're getting the anti-inflammatory benefits on top of that. So you're getting some immediate relief, but you're also, in a sense, slowing the underlying condition. Beta-myrcene. Now, actually, I came across something, since we had talked, and that was looking at the patients that have benefited the most in terms of the arthritis patients. Most of those products have beta-myrcene in them. Mm-hmm. And, here we're getting not just the analgesic effect, but I think we're getting also, the anti-inflammatory effect, but also some degree of muscle relaxation. And so a lot of the strains or chemobars that patients get a lot of benefit in arthritis have beta-myrcene in there.
Mm-hmm. Yeah, and the other ones, like you talk about pinene. I know pinene is something that's really interesting. And that's again where it goes to the anti-inflammatory. Again, pinene is very, very good for that. It's very earthy itself. It has a smell very much like pine needles itself. hence why the name is similar to that. But I also find out that it's also great for memory, which both has that's kind of a two-edged sword. One side, it'll help with your memory. On the other side of the coin, if you're suffering from conditions like PTS, you may not want to play something with pinene, because obviously you don't want to be triggering a lot of the negative memories that you were trying to bring back. So pinene is important. It is good. But again, pay attention to it, especially if you're a PTS patient that's out there. But it's something that, if not, it's great. It's a great anti-inflammatory.
Yeah, and I think the best way to approach that, let's say someone is dealing with, problems with memory. They want to improve their memory, but they don't want to make the PTSD worse. Just try to stick with a product that has more of a lower dose of pinene, so you're getting some of the benefits, and your body is increasing your acetylcholine. There's also dietary things patient can do. For example, increase your consumption of eggs. That can help your body make more acetylcholine as well. So it's one of those things where we want to have the benefit, but we don't want to get to a point where we're having negative side effects.
Right.
Yeah, I found that interesting as well. The other thing I wanted to say, with memory specifically for Alzheimer's patients, is there's a type of inflammation that forms in the brain. It's called neurofibrillary tangles. And so if you have a patient that's dealing with memory problems, you would want to stay more with the high content of CBD, less THC, which can affect memory, and products that have alpha pinene. And so if there's a situation where a patient is taking a product for a while, that product is gone, because that happens a lot of times. Products run out of supply. Just try to stay in that similar category of another product that has high CBD, lower THC, but alpha pinene. And then also supplement, the dietary things you can do: omega-3, omega-6, flaxseed oil, olive oil, Mediterranean diet. So, add that, so you're getting basically a full spectrum of benefit, not just with the medicine, but also getting benefit with the dietary intake as well.
Sure. And caryophyllene actually has is a good terpene to use. I know that it's got, again, the anti-inflammatory effect, and it's popular. It's in a lot of the strains that we find out there as well.
I like that name, caryophyllene, because it'll carry you to better days. I remember we had talked about this trick, if patients, let's say they take an edible, but then they take too much, overdo it a little bit.
Yeah.
Take a spoonful of pepper, because caryophyllene, it actually, the full name is beta-caryophyllene. It works a little bit like CBD works, right? So it stimulates your CB2 receptors. And so, if you don't have any CBD on hand and you take too much of your THC, that was one of the tricks, is to take a spoonful of pepper. I mean, it may not be pleasant, but maybe you want to take it in juice or something sweet. But this is something that could be almost like a rescue thing. You don't see it being studied very much, because one downside about the pharmaceutical research industry is, why would we study something that's beneficial if it's available to everyone? We have to profit on it some type of way. But sure. I think we should do more studies, especially with different strains that have caryophyllene. This last one, eucalyptol, everybody knows what eucalyptus smells like, right? So if you ever, in the store, walking around and you come to the home goods section, that's one of the popular oils for aromatherapy. Is also in, for sale as a eucalyptus, actually just the tree, just the branches, which you can take home. It's a good remedy. I think people use it for like mosquitoes, to prevent mosquitoes from accumulating in your backyard or on your porch. But it's a lot of other uses to that, the eucalyptol. But as far as cannabis, this is probably, out of this list, this is probably the least common one. But again, this also has benefits in pain relief, also has benefits as an anti-inflammatory. But that's something that you could use to supplement with your aromatherapy when you're taking your medicine. And
there's some studies out there that have shown that it helps address the dementia as well. Now, where do we find those? When you go into a dispensary like Trulieve, what you'd like to be able to do is say, here's the terpenes that I'm looking for. And then you can walk in with that terpene profile to Trulieve and say, give me something in this particular category and it'll help you with the strain arthritis. But here's some specific strains that here's the strain and the terpenes profiles as well.
Wow, Mark, I mean, you're hitting them really hard with the Girl Scout cookies as the first one. So, man, you just kind
You
of.
got it, man.
So the Girl Scout cookies, that's going to be the more experienced patients right there. I
Sure.
mean, it sounds like, you think cookies, Girl Scout cookies, you're going to take it and you're going to have fun. But keep in mind, this is a stronger medicine here. So look at this ratio here in that third column, right? 19 THC to 1 CBD. So this is going to be the more experienced patients. All right. So this is not something, if you're just starting, if you're new to cannabis, don't jump to the Girl Scout cookies right away. This might be something that over time, maybe you will at some point need something that has a higher ratio, meaning more THC than CBD.
Probably want to start down here. Excuse me. Probably want to start down here with the ACDC.
So yeah, let's look at this ACDC. So this third one down here, and look at that ratio, right? So that's 1 THC to 14 CBD. And this is a range. So the actual product that the patient may get might be, 12 to 18 or 20 CBD, but that just gives you a rough idea that there's much more CBD than there is THC. So this is going to allow you to get not only high CBD, but then get the beta myrcene as well. And the great thing about this slide is it has the products that have beta myrcene, which was consistent with the reports that I was mentioning earlier, that the patients that get the most benefit for their arthritis, they have medicine that has beta myrcene in it. So you're going to get your entourage effect there. You're going to get your analgesic effect, your anti-anxiety effect. For those patients with dealing with epilepsy, this is also a good chemovar to take as well. So let's go actually look at those next two below that one. So, Harlequin, which is a sativa, and all that means is it's going to have an uplifting effect. And, with a lot of the sativas, a lot of them also have, not just beta myrcene, but limonene as well. And you see that's almost a 1-to-2 ratio, right? So I'm just going to round off the numbers. So 5 THC to about 10 CBD, right? So that just gives you a rough estimate that there's about twice as much CBD compared to THC.
Sure.
And, again, the beta myrcene is going to give you your entourage effect. And there's a range of flavors and aromas, and that's going to depend on the terpene content. So it could range from earthy, if there's not, much beta myrcene, to if it has a high content, it's going to smell more like mangoes. And actually, you can take mangoes to supplement your cannabis because that's going to have beta myrcene in it. I believe also, I think basil also has some beta myrcene in it, but we can check a little later. And so your analgesic benefit, your anti-anxiety benefit, so your relaxation. So anytime you're dealing with pain, you're prone to have muscle spasms and feel very tense, this is going to help you relax. And this next one down, Canna Sue does it in a little bit different way. So this is a hybrid. So this is kind of a blend of, sativa and indica. So in a blend of what's uplifting and a blend of what's relaxing. Also in a similar 2-to-1 ratio with beta myrcene. You see, it's going to have a different aroma because it's going to have a different terpene profile. Sorry. So citrus aroma, also an analgesic. It's going to give you even more anti-inflammatory benefit, anti-anxiety. And for the patients that's dealing with seizures, it's an anti-seizure medicine as well.
Sure. Now, it's important to point out something here. If you look at, other than our Girl Scout cookies, the ratio of CBD to THC for most of these strains is higher. You're getting more CBD than THC in most of these strains, which is really something that you're looking for, because I think especially with arthritis, reducing that inflammation goes a long way to not only helping to get your mobility, but also reduce the pain.
And then, also we're going to have less side effects. So patients that's worried about being hungry. So let's say you have an obese patient that has arthritis because of the obesity. We don't want to make the problem worse, right? So we're helping the pain, but we're increasing the patient's weight because now they have the munchies. They have a lot of cravings for food. When you balance out and have much more CBD, it's going to reduce the chances. I'm not saying you definitely won't feel more hungry, but it definitely reduces that effect when you have much more CBD to protect you from those side effects.
Sure. And by the way, I'm going to take a quick break and just say, please let us know your questions. I know either we're doing a great job of covering the subject or you're being quiet on the questions, but please feel free to bring up your questions. We're here to be able to answer them and go forward.
I think they got scared, Mark. You hit them with that Girl Scout cookies first. I think patients got scared. Like, look at all that tea.
Every time. So it's out there. Well, I did want to point out again that the state, I think most of the approach is to take a strain that has more CBD than THC in it. And I think that's really the direction that a lot of people tend to go. Let's talk about where we actually, the routes of administration. I think one of the things that's fascinating to me about cannabis is there's not just one way to take it. I know there's the old famous take 2 pills and call me in the morning, which is what the pharma industry is based on. But cannabis has been around for thousands of years, and there's a lot of different ways of taking it. Take us through these are kind of the main routes of administration that you find with cannabis. And they all have different, what I call onset times. How long does it take to work? And then when it does start working, how long does it work? So kind of give us some insight into that.
Yeah, well, I kind of like to relate this again to anesthesia, with that being my specialty. So, there's a variety of ways that we can give anesthesia. So we can give it IV, we can do a nerve block, we can give the patient oral medications before they go back to the OR to help them relax. So there's a variety of ways to take medication overall. Now, when we look at just, general medications outside of the specific specialty of anesthesia, medicine can be inhaled. So, like an albuterol inhaler, medicine can be taken under the tongue, like nitroglycerin if a patient is having chest pain. Medication can be taken orally, not necessarily always needing to be swallowed, right? So we can breathe in oxygen. That can be delivered as a medication if a patient is having a heart attack or stroke. And one thing about cannabis is it's so versatile. It's the most versatile medicine because that particular medicine can be available in a variety of routes. Let's compare that to an anti-inflammatory medication. So like ibuprofen, there's really only one way or two ways you can take that medicine. And it's usually either orally or topically, right? And usually the topical one, there's one called diclofenac. But when we look at cannabis, patients can take a variety of routes based on their goals. So if you want immediate relief, you can take the inhalation route. So inhalation is going to work within about 2 minutes. If you want something to last a little bit longer and want it to work fairly quickly, you can take it under the tongue. And so that's called sublingual. It will take about 20 minutes, but it often works longer than the inhalation. If you need more of a longer term relief, something to last 8 to 12 hours or longer, then you can take it by the oral route. And that's where you swallow a pill. You can even take a powder mixed in a drink. You can even take it as an edible. And those take a little bit longer to work, but they tend to last longer. One thing about that route, though, is with the THC, your body does convert it to a stronger formulation. And so that's where we tell patients to be very careful with the edibles. So if you're new to cannabis and you're taking a THC edible, try to start with the 5 milligram product or a 10 milligram where you cut it into either quarters or you cut it in half. Because if you take that medicine and don't wait the proper amount of time and take it again in 30 minutes and again in another 30 minutes, you can kind of overshoot what you're trying to do. And it could give you a feeling of paranoia. It won't kill you because, again, there's no receptors to suppress your breathing, but it can be a bad experience. And we want patients to always have a good experience as they're slowly titrating up on the medicine.
Yeah, and because it's being absorbed in your
topicals.
Yeah, because it's being absorbed into your stomach lining, it does take a much longer time to work. It could take 1 hour to 2 hours to work. There's kind of this famous saying about oral or edibles, about the time you don't think it's working and you take another one is about the time it does start working. So it's very easy to be able to get yourself into a position where you're getting 2 or 3 times the dosage that you were looking for, which can cause some side effects that you may or may not want. Some people may want it, may not want it. It's kind of totally up to you. But edibles, you have to be very careful of because of the long onset time.
Yeah, so remember the twos, okay? So if I take it by inhalation, it's going to be 2 minutes. If I take it under the tongue, it's going to be 20 minutes. If I take it orally, it could be 2 hours. Topical is the most variable. Patients can see immediate relief, like literally within a few hours, you can see the inflammation being reduced. It just depends on the severity of your disease process. It might take 3 days. I mean, so topical is very variable. It could be 3 hours to 3 days. But the thing to try is to try to take consistent dosing. Topicals, you won't have that same, risk of taking too much and kind of feeling, dizzy or off balance that you will with the other routes. And so with topical, you can go ahead and dose that several times, and it gives you much more leeway in terms of, increasing the dose at a much faster rate.
Yeah, and also it's interesting to point out as we look at the different options, you can mix and match them. I mean, I'll give you an example of myself. I have 7 herniated discs in my neck, which is no picnic, and it can be very painful. And my goal is to get the inflammation down because obviously that reduces a lot of the pain, but also to address the pain itself. And so when I wake up in the morning, I have sublingual drops on my nightstand and I do take that. It takes me, in my particular case, 20 to 25 minutes before they actually kick in and start working. But what I'll do is I actually have a vape pen right next to it and I'll take 1 or 2 hits off the vape pen and literally almost immediately the pain goes away. And what I mean, the first time it happened, I had a level of pain. I can wake up sometimes with a level of pain in a 7 or an 8. And the first couple of times I took a couple of hits and the pain level dropped to below a 1 within a minute or two. I mean, I was saying to my wife, this is crazy. I mean, this is like somebody wiped my back and took the pain away. Even this morning when I did it, I still am amazed at how fast it does in fact work. And it worked for a couple hours, which is great. And it gives time for the sublingual drops to kick in. Now, in my particular case, the herniated discs aren't going to go away. So I have a regime in the morning. I have something I do in the middle of the afternoon. I have something in the evening to be able to really go through the day, because if I don't, it'll come back. Okay, so I have to be able to pace myself.
Right, and in traditional medicine, what we have is your long-acting medicine and then your immediate release, right? Mm-hmm. So you'll have some medicine that is going to last longer, give you some pain coverage all day. So that's going to be your sublingual and your oral. And then when you need that as needed medicine for those spikes in pain, you have your inhalation route.
Right. Yeah. This is the chart right here. It's a little more, it's going to be included in the deck, which, by the way, you will get a copy of this particular presentation, or a link to a copy of this particular presentation in an email as a follow-up. And I know there's been some comments about some people have not been getting the emails. If that's the case, please let us know if you don't get an email. And I think the best way, Lee, can you put in the chat, if you send an email to event@marijuanaaware.com, and she's going to put that in the chat. If you don't, by Monday, if you don't have something in your email box, please contact us. We'll make sure you get that information that's out there. And then the other side of it is, if you go to the website and you go to the Marijuana Aware website, click on the tab that says follow-up. If you click on that, it'll take you down to a web page on this particular webinar that has the video, it has the presentation and all the information that's there. But we want to make sure you're getting that. Naturally, check your spam filters, your spam folders, but please make sure you get the follow-up, because we are sending them out and we want to make sure you get them there. Let us know if you're not getting them. We'd appreciate that. But on this particular routes of administration, I put this together we put this together, I should say, so that you can take a look at the different options that you have that are out there. And as you mentioned, cannabis is very, very interesting, and that there are so many different ways that you can use it.
Yeah, this is, very, very similar to the previous slide. It's just going in a little bit more detail, right, where it's talking about, you look at the different formulations there: sublingual drops, inhalation, capsules, edibles, topicals, transdermal patches. So it's showing some of the other routes or other ways to take the same route. So topical and transdermal, both ways it's going through the skin. Sprays. So a spray can be taken as like an oral mucosal. So you can spray it under the tongue, you can spray it in the side of the mouth, and it absorbs through the mucosa. Right. One thing that's not listed here is rectals, or in suppository is not listed on that one.
Yeah, I do want to point out one thing, though. You and I chatted about, a lot of people, I get a lot of folks that tell me, well, I'm just going to smoke a joint and it'll solve the problem. And I do think that there's no question that using what they call flower, smoking a joint, will help you. But pay attention to the fact that the minute you put that match up to that joint, that 500-degree flame burns off all the terpenes, all the flavonoids, and 50% of the cannabinoids. So you're taking a lot of the medical benefits away from cannabis. And what's amazing is, even though you do that, the medical benefits that are provided are just tremendous. It still has a tremendous effect, positive effect, even with all that going on. That's why concentrates are there. What they've done is been able to take that flower, break it down into concentrates, into resins, waxes, butters, whichever flavor. You have a device that you can be able to put those in, and it really not only helps you get the benefits of the flower, but you can get them and you can maintain a lot of the terpenes and a lot of the flavonoids that are there. And that's what concentrates are all about. A lot of people that you're starting out with medical cannabis, don't pay attention. Concentrates are something that may be a little bit too complex to begin with. but after a while, you'll be able to find that it's something that you can use. Not only is it effective for you, but also is cost effective as well. It's there. So I'm a great concentrates fan. So. Dr. Newton, let's answer a few of the questions that they have out here. Kimberly had a good question. She said, I recently started using RSO CBD. Have you seen this particular question?
So, RSO is just an abbreviation for Rick Simpson oil. So Rick Simpson was a medical marijuana advocate who used concentrates basically formulated through ethanol extraction. So he used it to treat his skin cancer, and he also grew the medicine and prepared it for other patients. And so, there could be a variety of, THC, CBD, the other cannabinoids that could be in the medication. So, it sounds like the patient is asking about a ethanol extracted concentrate that is high in CBD. And, with CBD, being something that's going to, not only reduce the inflammation, but also going to help with anxiety. It can also help with sleep and give the patient more of a sense of well-being. Having higher doses available to you in a concentrate that does give you, higher doses with less volume of medications. Mm-hmm. So it's something that, a lot of patients could definitely benefit from.
But I think you're, the one thing about cannabis is that the one who's going to tell you what the right dosage is your body. I think that this is something that is a very personalized medicine. For some people, it's almost like alcohol or caffeine. And we'll talk about this at the end of the presentation about dosing. Some people can have one drink and they're done for the night. Some people can drink the whole bottle and they're just getting started. It has to do with a lot of factors in your body. I know that cannabis is much the same way. And what's going to happen is that I don't think Dr. Newton, you as a doctor, can actually say for every person, here's what you need. It isn't like 2 pills and call me in the morning. But if you go low and you go slow, your body will tell you what's the right dosage. You'll know when you feel good. You'll know when you're getting to what I call that therapeutic relief level. And then you'll also know when you've kind of exceeded it, because you may get a lot of the anxiety coming back. You may get a lot of the pain coming back because you've gone too far. So I think your body's going to be, isn't it your body kind of the best judge of your dosing?
Right. And there's a method of starting extremely low and going extremely slow and kind of taking your medicine throughout the day, 5 to 6 times is called microdosing. And so there you're just taking, 1, 2, or 3 milligrams at a time, throughout the day and kind of seeing, what your sweet spot is.
Sure.
One thing I would recommend is, if patients dealing with arthritis, severe knee pain, if they're dealing with balance issues, is definitely try to make sure that you always have more CBD on board and available, because we don't want you to run into a situation where the THC causes you to be a little dizzy, a little off balance, and then you have a fall and now you're dealing with another issue. So, with anything, start low and slowly, increase it. You may want to have a product that has just pure CBD on hand, as well as you're getting into the higher THC products.
Sure. Great. It's a good question by Rob. Why do local dispensaries not often carry CBD rich vape oils?
Why don't they carry CBD rich?
Yeah. I think
we do. We have like
you have a REM product. I know you have a REM product that falls in that category of CBD.
Yeah. 8-to-1 product. So, for every 80 milligrams of CBD, you're going to get 10 milligrams of THC.
Right.
It's a little bit more rare to have something that's pure CBD, because with regard to the cannabinoids, maybe you're getting a little bit less entourage effect. It is good to have at least a little bit of THC, some CBG, which is cannabidiol, so it can act synergistically with the cannabinoids, but then also the terpenes. But as far as just something that's pure CBD, that's not as beneficial as having something with what we call full spectrum, full plant benefits.
Sure, it's there. I think a lot of times is because dispensaries tend to sell not only just the CBD but also THC, and that's kind of their main product lines that are out there. Like I said, it's fairly rare to find something that doesn't have at least some THC in it itself. Susan, I'm going to answer your question about getting a copy of the last 2 slides. You'll be getting a copy of a link to a presentation deck that'll not only have the last 2 slides, but it'll have all the slides that are in there. So hopefully that'll answer that particular question for you. So Dr. Newton, let's talk about Trulieve. I like to, where do you get these products? The answer is Trulieve. And the interesting part is, and I put this slide up because I always get comments from patients and from friends about thinking that when they go to a dispensary, they're looking at like a head shop. They're looking at, there isn't enough of the, how should I say, the raster look to these things. Trulieve dispensaries remind me of, it reminds me of an Apple store. My wife tells me it looks like Chico's, but I mean, it's kind of interesting. It's really a really upscale retail location.
Yeah, it looks great. And I see in your background, you're at one of our locations now. It looks like it's pretty empty, so we better.
Well, actually, this is I took this picture off of Puerto Gordo when you opened it up. So this is a promotional video or photo that you put out there.
So you're not live. You're not live on site, on location.
No, actually, we did a couple of live broadcasts from dispensaries. I'll tell you what happened was, in one of the cases, the power went out, and so the variables in doing it in a dispensary got to be the point where we kind of control it in the studio environment for a whole bunch of different quality reasons.
For our weather, you must have been in Tampa area. I used to live there, and if you don't like the weather, wait 10 minutes.
Yeah, that's about it. But speaking of Trulieve, these are the dosing forms that we talked about earlier, and here's the different products. They actually line those up against the products that you have.
Right. So, what we're looking at here is, this top row, some of the edible products. As you mentioned in one of the previous presentations, is there's a certain criteria that we have to have, with the edibles. So if you're getting a raspberry flavor versus a blueberry flavor, it still may look the same. So it's not necessarily colored like something you would find in a grocery store or regular candies. But we do have sugar-free versions of these edibles, which are also sweet. And then you see the chocolates there. Mm-hmm. With regard to, there's an earlier question about high CBD. So look at this tincture here. So this has both options available. We have a 1 to 8 where there's less CBD and more THC, but there's also an 8 to 1 where there's more CBD than THC. So this is a good product that gives you a few options. If the patient is beginning, they can have, a lot more CBD. From this product, you might go to a 1 to 1, so like a True Clear, for example. Right. And if you don't get the benefits that you need, or let's say you need to add something a little stronger, the 1 to 1 is helping, but at times you need much more THC. So you could continue with your 1 to 1, but then add another product. So this is a 1 to 8, so 1 part CBD to 8 part THC. Sure. And then we have hybrids, which are a blend of sativas and indicas. We have indica rosins, which are going to be more your concentrates. We have, of course, the whole flower, which can be taken as smokable or in a tea. That's something that you want to get some guidance from one of our consultants and also your physician. And then we have various ways to take it through vapor pen. So this is where you need immediate relief, and you'll get a benefit within 2 minutes, and the medicine will peak at usually at about 5 minutes. So when you need that relief right now, this is a product that you can go to. And then for your longer acting, you can keep the edibles, the capsules, the sublinguals.
Sure. I know there was a question, by the way, while we're on this slide, of because someone has diabetes, they're looking for something that's that is basically sugar-free, and you have sugar-free products in your edible categories now.
Yes, we have sugar-free edibles. So with those, the patient doesn't have to worry about their glucose levels skyrocketing. And of course the other option is to utilize one of the sublinguals or a non-edible product. But mm-hmm. As far as if you want to have the edibles and you have diabetes, you can take these that are sugar-free.
Right, and they're in the product line now. I know there are things out there. One of the questions is, are there terpenes in the chocolates?
Yes. So for every product, there is what we call a certificate of lab analysis. And so if you scan that QR code, it'll tell you exactly what's in there, what's in that profile.
Yeah, and there are terpenes in the chocolates. What terpenes are in there? Again, on the label itself will be a little like a QR code. Scan that with your smartphone. You'll be able to see the profile. You see the lab results of how this thing's been tested. And what's important is Trulieve, which is regulated by the state of Florida, will do 2 internal tests for all the products, and then do 1 test from a group that's outside of Trulieve to make sure that the product is in fact a quality product. And that again helps that's the state of Florida just making sure that you have a quality product that's being put in front of you and that it is safe. But yeah, there are terpenes in there. Which ones are there? It just depends on the actual product itself, and you can be able to. Now, I think also if you go to your bud tender, the person behind the counter, and you ask them, they'll be able to find out and find for you the terpenes that are there.
Yeah, and also on the certificate of lab analysis, you'll see that the product it's passed an inspection. There's also looked at pesticides. There's also looked at mycotoxins, which are certain toxins from microorganisms. It's also looked at heavy metal contents, that there's no arsenic in there. So when you're growing your plant, the plant is going to soak up whatever's in the soil. Mm-hmm. And so we need to make sure that there's nothing in the soil that's been taken up by the plant that could harm a patient.
Right. And you talked about the various ratio products. You've got your 1:8s, your 8s to 1s, and there's a number of different mixtures that are out there. And what I find interesting is, Trulieve is fairly cost effective. These products are like $55 compared to other dispensaries.
Yeah, well, not just cost effective, but also there's a technology that's in a lot of our products that helps the patient absorb more of the medicines. So whenever we, eat something or take medication, through our GI tract, we don't absorb all of it. Sometimes you can absorb as little as 6 to 20%. With this nanotechnology, what it does, instead of the molecules kind of sticking together, kind of separates them. So now there's more surface area, you can absorb more, and that's called bioavailability. It's like how much of the medicine is actually getting into the bloodstream. Right. So this is with a variety of topics, a variety of products. The tincture again is something that you would take under the tongue as a sublingual. We talked already about the 8 to 1 and the 1 to 8, and this is just showing you the full contents of the bottle, how many milligrams is there, only $55. And the true nano gels, so that's going to be 10 milligrams per piece, and that's what you want to cut in half if you're completely new to cannabis, or quarters, and basically microdose, take a little bit at a time. And once you get more experience and find your sweet spot, then you can take the full gels, a whole product at a time. And
then you also have your vaping mechanisms, your true pods, your vape pens, your gels, as well as your capsules and true clears.
All right. And so again, if the patient is looking for an indica-like effect, hybrid or sativa, which is where you might need to have more of an uplifting, more of an energetic effect, there's a variety of products there. And we have the vape carts and the true gels. And so, looking at these ratios, I do want to point out here actually 2 things. So, with your 1 to 1, that's going to be your more balanced product. And so that's going to be very good for a patient dealing with arthritis. So they're going to get benefits in the inflammation from CBD and THC. They're also going to get some relaxation with the CBD, and also going to get a potent analgesic, which is the THC. When we come down to that next row, the 5 to 1, more experienced patients, you're going to get your THC, and then the CBN, which is good for not only sleep, but it's also good for pain as well. And that's actually one of the end products of THC is CBN. Yeah. And then this third one, you're going to get your CBD and your CBN. Again, a good product for anxiety, a good product for relaxation.
Yeah. And the only thing I'm going to point out is because of the popularity of especially sleep being one of the main issues related to cannabis. And by the way, next week we're doing a webinar on sleep. Getting these products, sometimes you go into the store, they're out of stock. And just being able to keep it in stock has been a real issue, and that's a positive. That means people are using it. But I think that's one of the challenges that you're facing right now, just getting them in stock, right?
Yeah, and we look down here at the bottom, True Clear. That's one that we generally have in full stock. This is actually one of the most popular products here because it's a balanced, versatile product where you could take it by inhalation, you could take it sublingual, you could take it orally, put it on a cracker, put it on a cookie. It's essentially having your own edible, based on your physician's recommendations.
Sure. Let's look at some of the discounts that you all have. That's always the favorite topic. One of the things I love about Trulieve is you have a plethora of discounts, loyalty programs through veterans programs, birthdays, SNAP, RSO, if you're using a high concentrates of RSO. You guys have done a great job of offering discounts to really make it cost effective for the patient. But I think also one of the things that you do that's not mentioned here that I think is the biggest discount is if you have a product that it doesn't work for you, bring it back and you'll exchange it, right?
Yes, we have a exchange program. As far as I know, we're the only dispensary in Florida that has that program, where if a product is not working for a patient, they can bring it back and exchange for a product that would potentially give them more benefit. And so, it's not covered by insurance. So that's the unfortunate thing about this treatment. But we have these different discounts, and I have to, thank the group there, at Trulieve. I haven't personally made these discounts. Actually, they had these discounts from the beginning, as far as I remember, back when I was giving recommendations before I became the medical director. And they also have a loyalty program and a veterans discount. And every holiday that comes along, there's another discount. So be good to go ahead and sign up. It has the web address here. We can sign up and get the get a text message on the different promotions that are coming up. But there's always something new coming up. Every month, every other month, there's a brand new program that patients can be enrolled in.
And one of the things I really like is also every year when you renew your card, you get 75% off to be able to cover the cost of the card, which is great.
Yeah. 50% off for new patients, 15% for your second order. We also have different, referral programs, helping to cover the cost of the card. There's so many just great programs that's there. Next slide. I think that's another one of your favorite programs too, is the delivery that's free.
Yeah, I was going to mention, I'm a senior citizen, and I know your delivery program is only $15 anywhere in the state, which beats anybody's price out there. But if you're over 65, you have they'll deliver, which I think is great.
Yeah, for over 65 for orders of more than $200. And if you order before 12 for most areas, you can get same day delivery, same day or next day delivery. So it's a great program that's set up.
Sure. And one of the other things I like is if you do decide to pick it up, because there are times when I'm driving by the dispensary, I'll just want to go pick it up myself. You have an app that if I place the order, as I'm driving to the dispensary, I can hit the app. It puts me in line, and so I literally walk in and just walk right in and get it, which I think is great. I think that's a great, very convenient feature of your pickup service. So, Dr. Terel, we've been at this. I don't know if we have any questions. I don't see any questions on Trulieve. I think you've done a great job of covering that. Thank you. So let's talk a little bit about dosing. I know the real magic to cannabis is the dosing part of it. And I know you talk about go low and go slow. I think that goes back to the fact that, everybody's body is different. I mean, I wish when I was in college and I was getting into drinking, I'd have learned about the go low and go slow program. Unfortunately, I didn't follow that recommendation, or sadly, or whatever. But I think that's something
really, really with a bomb. Were you like upside down drinking?
Yeah, it's crazy. I wasn't a big drinker. I was kind of an athlete in college, but I do know that there are times when I should have gone low and gone slow. Let's put it that way. I went to engineering, and I went to Cal Poly in San Luis Obispo, which is engineering and cowboys, and I lived with the Cowboys for 4 years. Those boys could drink, man. You got to be very, very careful. A lot of fun, great times, but boy, when they decided to get down, they got down. So unfortunately, Marc sometimes joined them, which wasn't a good idea. But I'm just saying cannabis is kind of the same way. I think going low, taking it slow, using the one-to-ones, find out what your tolerance is for THC, and then upping your quantity of CBD is really a good way of helping you find your sweet spot.
Right. And so, what this is, taking a little bit at a time till you start to see some improvement in the symptoms. If you start to see side effects first, then that tells us that there might be too much THC. And so what we want to do is increase the amount of CBD that you're taking. So for example, if a patient is, let's say they're taking a vape pen and they're taking it for pain, you're going to take a dose. It's going to work within 2 minutes. If you don't have a benefit within 2 to 5 minutes, go ahead and take another dose. If you start to feel dizzy, start to feel lightheaded, but you're not getting any pain relief, that's telling us that you need more CBD on board, because the THC is the one that has those side effects. It's rare to see any problems with dizziness and balance with CBD. So what we want to do is increase the CBD, so that way you can get the benefits and the protection of the CBD, which is going to reduce the side effects of the THC.
Right. There's a couple of questions that came in I do want to address. One of them is from an anonymous question. It says, I find CBD tincture has no effect on me. Does it not help some people? You want to address that one? You want me to take it?
Yes. There's nothing that helps every patient. What can be done is you could even switch the type of CBD tincture to a different profile so that you have additional terpenes to increase your entourage effect. If there's a risk for, balance issues, or you're worried about the side effects of THC, you can stay within that category and try different products. And you can also gradually increase it. We had an interesting question earlier. The patient mentioned a concentrate with CBD. So that's another option. The one-to-one product might be a good option as well, to where you're just, taking a balance of both. So it's one thing that we can't predict. We can't just look at a patient and know, okay, this is what they're going to need. This is, the final dose. But if you start, trying different products within that category, or slowly increase the amount of THC to get the entourage effect, then you're likely to eventually find some sweet spot and some benefit.
And you may be using some CBD that's what they call broad spectrum, that has very, very little, if any, THC in it. And you really need a little bit of THC to be able to trigger a lot of what they call the entourage effect to really make that happen. And that goes back to what you were saying, Dr. Newton. Try different profiles, because you may want to get into a full spectrum versus broad spectrum. That could help you quite a bit, or be able to cross that line into something that has like a one-to-one.
But there's another issue, and we don't know if the product is a retail product, but there's a study that looked at CBD products over the counter, and it found that over 60% of products were mislabeled. And some of those mislabelings were they had no CBD in there, or the amount of CBD was less than what's listed on the label.
Listen, I did a personal study getting ready for one of the webinars. I went to 5 of the CBD shops and looked at what was on the label. And there was only 2 of the CBD shops that had COAs that were reasonable, and that were really, how should I say, what you had on that COA was actually what's in the bottle. So 60% of the time it was mislabeled, and that's not uncommon that's out there. But I think and then one of the other questions, I know, and some anonymous question asked me is, I asked for sunscreen that's one-to-one. I've not seen any sunscreens that has a one-to-one. I know there are some CBD shops that are marketing sunscreens that have CBD in them. And again, I would be cautious because again, I'm not sure what the COAs are, and I'm not sure the benefit of pure CBD would be for a sunscreen. I think this is where you want to, if you're looking at a topical, use it for a topical. I'm not sure there's any benefits from sunscreens of using a CBD that I'm aware of.
Yeah. I mean, it'd be worth a research study. It'd be interesting to see. But the main thing you want to check is, how potent is your sunscreen, and
right.
For patients that's at a risk for skin cancer,
right.
You want to make sure that you check with your dermatologist. If you have certain lesions on the skin, they need to be monitored to see how fast they're changing.
Yeah, and I do want to correct one thing, Dr. Newton. I said 70% off of one of your discounts. It really is $75 off. I apologize for that. I'm giving away some of your money without asking you. Apologies for that.
Yeah. So, but that's an important question, specifically for Florida, to look at the SPF. So the sun protection factor, and, the higher the number, the more protective that the lotion is going to be. But,
right.
It's very important if you're going to have, sun exposure, to keep your skin protected. That's a very serious thing where you can develop skin cancer.
Yeah.
Skin cancer for some patients can be a silent killer. And it's something, especially if it's a malignant melanoma, it's something that it's like the iceberg effect, where you just see the tip of the iceberg at the surface of the skin, but
right.
the actual problem is much larger beneath the surface.
Sure.
And that's one of the cancers that can have a tendency to spread quickly through the bloodstream. So, if you are a person that is out in the sun a lot, make sure you're using your SPF, high SPF products, and you're talking to your dermatologist and taking pictures of your skin so you can observe if there's any changes over time.
Now, we've been at this for about an hour and a half. One of the questions people ask is, where do I get my cannabis? Where do I go to get a card? And by the way, if I want to buy quality CBD products, where do I go? And here's a list of that. I know that Trulieve is a very high quality and trusted dispensary. And I think that's something that if you're looking for medical cannabis, I think that's the place to be. If you're looking to get a medical marijuana card, my recommendation is MMTC of Florida. I work with them. I've worked with them for a number of years. And you might say, why MMTC of Florida versus other locations? They're the only MMTC, the only group that helps you get a card that also will help you with your dosing. They have a dosing center. They have a call center. You can call in and they'll help you with your dosing. And really the key to making sure the cannabis works correctly is your dosing. And I think having that ability, a lot of times when we deal with a doctor who by himself really can't answer questions during the day on dosing while he's helping other patients, they're large enough with 25 locations to have a call center to be able to help you. And they have cannabis trained practitioners to be able to help you. And then also we created a store called My Botanical Wellness. And why did we do that? Because a lot of patients were looking for, where do I get my quality CBD product? And this is where we took our physicians, had them look at the products and say, here's products that we know what's in the bottle really works. And we're excited. We just introduced a new product line called SunMed CBD products, which is top of the food chain. And so if you're looking for just CBD products, here's a place to be able to look at that. Here's some resources for you that's out there. But so Dr. Newton, we had some questions in the beginning. How did we do?
Wow, I think we answered a lot more than just these questions. So we got to pat ourselves on the back, I think.
Sure.
You know, we answered what is arthritis, is inflammation of the joints. So arthro means joint, itis means inflammation. It can also be degeneration of the joints. Osteoarthritis is the most common form of it. Rheumatoid arthritis is another common type, but then there's other types. Gout, pseudo gout, psoriatic arthritis, and traumatic arthritis. How does cannabis help improve arthritis? So, you know, there's several studies out of reputable universities that show that patients get benefit and if they use various forms of cannabis, CBD, THC, and other products. So if it does help, how does it work for arthritis patients? Number one, by reducing the inflammation, by reducing the anxiety associated with pain, by helping patients with sleep. And it gives really more, it addresses the issue in terms of helping the whole person. It's not like just ibuprofen. You're just reducing inflammation, but you're not helping with sleep. You're not helping with the pain signals. Which plants help with improve arthritis? So we looked at some of the chemovars, for example, ACDC, Harlequin, that have a variety of CBD and THC ratios and terpenes like beta-myrcene, beta-carotene. And so which specific products help improve arthritis symptoms? Part of that is the patient preference. You know, would they prefer to have the immediate relief of a vapor pen or sublingual? You know, can they wait a while and get a longer lasting relief with an oral product or edible? Do they need a combination of both? And most patients need a combination of both. So they need something that's long acting, like a sublingual or oral medicine, and they need some immediate relief. And that can also be taken sublingual or through a vapor pen. So those are the specific products that we looked at, which a lot of products that we have there at Trulieve. And you can even schedule consultation through our website and even just come in, see, and just have your questions answered and see the products, you know, live there in person. You don't necessarily have to, you know, purchase on that particular visit. You can just come schedule that consultation to learn more about the products that we have in our store.
That's an excellent resource. It's free. You can call up Trulieve. They'll set up a consultation. They can do it as a remote, like the Zoom call. They can do it like that, or you can do it at the dispensary. It's a free consultation. I think especially not only if you're first getting into it, but also if you've been into cannabis for a while, take advantage of it. There's no reason, it's not going to hurt you. And if nothing else, it's going to help you be able to get the most out of more bang for your buck on your cannabis purchases. So Dr. Newton, we've covered a lot of subjects. Thank you very much. I think we've pretty much covered the gamut of arthritis. I know next week you and I are going to be doing a webinar with sleep. And actually Dr. Holt is going to be joining us. He's from the one of the sleep boards. So we'll be addressing that particular issue. But thank you very much for your contribution tonight. Any closing comments?
Yes, I just want to again recognize, you know, this is Mental Health Awareness Month. And I think sometimes the best thing that we can do is just listen. You know, if you know somebody dealing with anxiety, depression, post-traumatic stress disorder, someone that recently lost a loved one, you know, just take the time to check on them, just listen for 5 or 10 minutes. That's such a therapeutic thing where a patient can talk about what they're going through. So I just really want to encourage you on that. Or if you're dealing with mental illness or, you know, dealing with anxiety, depression, talk to someone. Let someone that you care about, that cares about you, let them know what you're dealing with. Yeah. You know, with regard to arthritis, if you're dealing with severe arthritis, think about these alternatives. You know, if your therapy isn't working, if you have a knee brace or the injections aren't taking care of the pain, and take a more holistic approach. You know, if you are taking cannabis and it's helping with arthritis, you know, look at restarting therapy, look at possibly a knee brace. You know, think about just a more holistic approach. So that way you have more tools to fight this pain that you're dealing with.
Sure. Well, listen, thank you very much. As always, it's a great contribution. I want to also thank everybody who's really hung in there for an hour and a half. A lot of good information. Thank you very much. Again, if you have any problems getting the follow-up to this event at marijuanaaware.com, please let us know. The website itself will have a link to let you be able to get a hold of us. And I do want to thank everybody for spending the time with us this evening. We hope to see you next week if you want to address the subject of sleep. And Dr. Newton, I look forward to working with you next week on that particular webinar.
All right. Thank you. I'm going to get plenty of sleep until then. Okay. So I'll make sure I'm well rested.
Okay. Now I want you to have your homework assignment for next week is I want to understand your nickname Thunder. Okay. All right. You're not going to you got away with it tonight, but next week I'm going to ask you very specifically where that nickname came from.
Sure. We'll cover it.
Okay. Well, stay tuned for next week. Listen, thank you everybody for joining us. Dr. Newton, thank you. And more importantly, Lee and Leah, who are our moderators, thank you for the work you're doing in the background. That's more important than we don't necessarily people don't give enough credit for people who do that. And thank you very much. And I also want to give a shout out to Alyssa Katera, the lady who actually was the inspiration for a lot of these webinars. So thank you very much. Y'all have a good evening, and better yet, have a great Memorial Day. How should I say, I want to recognize a lot of the veterans that have given so much so we can get so much. But thank you very much. Have a good evening.
Thank you.